Senator Cannella said you were a tough crowd, so.
We're a small crowd here, but there's a big crowd out there.
Good afternoon, Mr. Chair and members. May I start with SB 1034?
Please.
Does that work for you?
Thank you.
Thank you. Again, let me begin by accepting committee amendments. With that being said, today I present SB 1034, a bill that will ensure that children diagnosed with autism have access to medically necessary treatments by extending the 2017 sunset on the requirement for health plans and insurers to provide behavioral health treatments to children with autism. In 2011, SB 946 was signed into law and was landmark legislation that required all health insurance plans to provide coverage for behavioral health treatment for autism. The mandate included a sunset to provide an opportunity for the legislature to revisit various issues regarding the implementation of the essential health benefits under the Affordable Care Act. The federal government has since provided guidance on EHBs and determined that this treatment is covered under California and federal mental health parity. This bill extends the sunset provisions to January 1, 2022 to allow the legislature to once again reevaluate behavioral health treatments if necessary. Additionally, it addresses several issues raised by consumer advocates that are intended to increase access to treatment. This bill updates the definition of behavioral health treatment to ensure coverage for interventions designed to maintain functioning, which is critical to children with autism. It limits unnecessary treatment plan reviews and clarifies that medically necessary services cannot be denied based on time or location of delivery of service. It ensures that medically necessary treatment cannot be denied based on the ability of a parent or caregiver to participate in the plan itself. I've got here with me several witnesses to speak in support, representatives from Autism Speaks, the Center for Autism and Related Disorders, and from Autism Deserves Equal Coverage to provide additional testimony in support. I ask for your aye vote.
Thank you. See, we have 3 witnesses, so you have a total of 6 minutes, so however you split that up, okay?
Thank you. Melissa Cortez-Roth on behalf of Autism Speaks and the Center for Autism and Related Disorders. Autism Speaks was actually one of the co-sponsors of SB 946, so I did have the privilege of working on that initial legislation, which really was years in the making. Families had worked very hard with Senator Steinberg at the time to get the standard of care, to get that coverage for their families. And since that passage, countless families have received behavioral health treatment through their insurance. They now get to receive medically necessary behavioral health treatments from qualified autism service providers. But it hasn't been perfect, and like any new benefit, there have been questions with implementation. And in this instance, most of the questions seem to involve the treatment plan. What can go into a treatment plan, what limits can be put on a treatment plan, and these issues typically end up at IMR. When disputes are brought to DMHC by consumers whose health plans have denied treatment for autism, they are overwhelmingly found in favor of the consumer. With the exception of adding interventions to keep functioning to the definition of behavioral health treatment, this bill does not expand the existing benefit. However, it does make clarifying changes to the requirements of the treatment plan in the hopes that families can better access the medically necessary treatments that are recommended by their providers. We ask for your aye vote.
Mr. Chair, members of the committee, my name is Julie Kornack, and I'm the Public Policy Director of the Center for Autism and Related Disorders, one of the sponsors of this bill. As you've heard, for the most part, this bill does not change the current responsibilities of the health plan. It simply provides badly needed clarification to ensure that individuals with autism receive the medically necessary treatment they need. And that health plan policies and procedures comply with both our State Mental Health Parity Act and the Federal Mental Health Parity and Addiction Equity Act, also known as MAPIA. In that regard, the existing mandate has some important language about providing treatment based on a treatment plan. Treatment plans represent a best practice in autism treatment because treatment is comprehensive and data-driven. So it's important to set treatment targets based on where the patient is developmentally, collect data during treatment, and analyze that data to determine whether the patient is making progress. The treatment plan may also describe parent training goals and the potential locations of treatment. Somehow, in the last 4 years, the mandate's requirement to base autism treatment on a treatment plan developed by a qualified autism service provider has turned into a condition of coverage. That is that the health plans require a treatment plan to be submitted and approved by the health plan before a child with autism can access treatment. Often, health plan representatives use this approval process to try to reduce medically necessary treatment hours, and in the last couple of years, many health plans have begun to require that providers use the health plan's own treatment plan template. One health plan has mandated that providers use its own 87-page treatment plan template. Recently, the U.S. Department of Labor issued subregulatory guidance indicating that this sort of practice may violate the Mental Health Parity and Addiction Equity Act. In this guidance, the Department of Labor cautions that for mental health and substance use disorder benefits, plan insurer requires a written treatment plan prescribed and supervised by a behavioral health provider. That plan may not be complying with mental health parity. And certainly we believe that the plans are violating mental health parity laws when they require the treatment plan as a condition of authorization of treatment, unless they impose that requirement on substantially all other medical and surgical services. The intent of the language in the current mandate is to ensure that a qualified person is involved in designing and supervising treatment, and we're not seeking to change that. We're amending the language to clarify that the treatment plan may not be used by the health plans as a condition of coverage to deny or delay treatment, and in general to impose requirements on autism treatment that are more restrictive than requirements for other medical surgical services. SB 1034 ensures that Californians have access to autism treatment that complies with mental health parity laws, and in doing so limits delays and denials that can make the difference between a child who is mainstreamed with his or her typically developing peers and an adult who requires support throughout his or her lifetime. SB 1034 strengthens California's longstanding commitment to the autism community to ensure access to autism treatment, safeguard best practices, and eliminate unnecessary delays and denials that deprive our most vulnerable citizens of life-changing, medically necessary treatment.
Mr. Chair, how much time do we have left?
About a minute and a half.
A minute and a
I
half.
have about a minute and a half. Honorable Chair and committee members, thank you for the opportunity to testify in support of SB 1034. My name is Kristen Jacobson with Autism Deserves Equal Coverage Foundation, one of the sponsors of SB 1034, and I also had the pleasure of working on SB 946 and serving on the task force. My organization assists families appeal denials for medically necessary treatment. Unfortunately, despite the mandate, there are some roadblocks to accessing this care. First, I will address time and location. ADEC Foundation has appealed approximately 10 location or time of day denials, and every single denial has been overturned, mostly by the Department of Managed Health Cares. But without our help, families typically give up. I have several IMR decisions here that I am happy to share with your office if so desired. The clarification is not a new requirement. One critical explanation, SB 1034 is not stating that a family can choose whenever they want to have treatment at their convenience. It states that health plans cannot categorically eliminate certain times of day for treatment, for example, between 9 and 3 when a child should be in school. The clarification will alleviate critical provider shortages because those daytime hours are not as impacted. The second clarification is designed to clarify that all families have the right to access medically necessary care even if they cannot participate in 100% or some arbitrary amount of the treatment hours. Parent participation denials disproportionately limit how treatment is provided to low-income families and families of color. I'm aware of a child who's having trouble getting care because their mother works too long. I think that is what I was going to say.
Great.
Thank you.
Thank you very much. Others in support, just your name and organization, please.
Hello?
Yes.
Okay, Helen Motter. I'm representing Behavior Frontiers and the Autism Business Association, and we strongly support.
Thank you.
Kathy Dressler with the Children's Partnership, and on behalf of the Children's Health Coverage Coalition, in strong support.
Thank you.
Mr. Chair, I'm going to ask for your leniency to give me 1 minute of time.
Just your name and organization,
My
please.
name is Faida Maliti. I drove for 2 hours, and I have
Thank you,
two
and-
children with special needs. Please.
Thank you.
Just
Please.
1 minute, please.
Please,
Just please. My name is Faida Maliti. I have 2 children with autism. I'm in strong support of this bill. And we shouldn't be penalized.
appreciate your support, ma'am. Thank you.
This room is to show this is for the people, not for the organizations.
Name and organization, please. Anybody else in support?
My name is Fred Baldy. I work at Behavioral Intervention Association. We are a child-first organization providing ABA services, autism services since 1988. I am in full support of this bill. Let's extend this thing for 5 years. Thank you so much.
Thank you.
My name is Ronald Lefevre. I'm a BCBA. I represent Autism Behavior Services, and I fully support this bill.
Thank you.
My name's Michael Forsberg. I'm with Autism Behavior Services, and we fully support this bill.
Thank you.
Karen Fessel, Mental Health and Autism Insurance Project. Fully support this bill. Thank you for making it happen.
Thank you.
Margaret Johnson, Disability Rights California. We support this bill.
Thank you.
Matt McAleer, California Association for Behavior Analysis, in support of the bill.
Great, thank you.
Sergio Pinto, Behavior Education Services and Training, and I support this bill. Ask for a yes vote.
Thank you.
Judy Darnell with United Ways of California, in strong support of the bill.
Thank you.
Kelly Hardy with Children Now in support.
Thank you.
Sarah Linder with National Association of Social Workers, California chapter, in support.
Thank you.
Ray Hicks, Californians of Disability Rights, in strong support.
Great, thank you.
Michelle Stoll-Parmensky, Children's Defense Fund, in support.
Thank you. Anyone else in support? Anyone here to speak in opposition? Please come forward.
Mr. Chair and members, Rick Rollins on behalf of ARCA, Association of Regional Center Agencies. We are not in opposition to the bill, but we do have concerns. We do want to express our strong support for that provision of the bill that will extend SB 946. ARCA was a strong co-sponsor of SB 946 and would like to see the sunset removed altogether rather than 5 years, but we'll take the 5 years. That, as I say, when we sunset autism, we can sunset this legislation as well. We have concerns about two other provisions of the bill that have been outlined in letters to you, and that's our position. Thank you.
Thank you. Others in opposition?
So if you stay and make the space available, we'll call you back if your testimony we think would be helpful. Are you going to do that for this time?
Please.
Good afternoon, members of the committee. I'm Jennifer Alley with the California Association of Health Plans, representing 48 public and private organizations that collectively provide health care coverage to more than 25 million Californians. CAP and its members are opposed to SB 1034. CAP members currently provide medical and applied behavior analysis services to their enrollees with autism. SB 946 of Steinberg shifted certain autism services out of the regional centers and required health plans to cover those services instead. Since then, autism care has become an essential health benefit. Our members have built an extensive infrastructure and network to comply with the requirements of SB 946. Because it is part of the health plan fabric, we are not opposed to extending or lifting the current sunset of SB 946. However, we are opposed to SB 1034 because of how this bill expands existing autism coverage in a manner that will increase costs on the private market and require coverage that contradicts medical literature and recommendations. Unlike other mandates before this committee, the premium impact on this bill is unknown. The expansions are so significant and outside normal benefit parameters that they were unquantifiable by CHBRP. This bill would require health plans to cover services at any time or location. Currently, health plans allow contracted providers to set their own hours of care, which is provided in a clinically appropriate setting. How a broad and vagueness of any time or location standard will influence provider contracts in the cost and accessibility is unknown. What does time and location even mean? We interpret the any time or location standard as forcing health plans into schools among possibly other undefined places. This would be the first time that health plans would be statutorily required to cover services in schools. It is unclear whether schools would want us there in the first place. Any health services received in schools are currently a special education benefit. Under this bill, the health care premium dollar will be used to supplement or replace special education, which will increase premiums. We are also concerned that this bill may restrict a provider's ability to actively engage parents in participating in their child's care. Studies have shown that success in treating autism is dependent upon parents or guardians reinforcing behaviors learned in ABA treatment. While our members understand the time-consuming nature of ABA treatment and are sympathetic to the commitments of working parents, we cannot remove parent participation as a part of the treatment plan. Otherwise, the behavior modifications will not be successful. In short, we oppose this bill because it's very expansive and vague. Most of its costs are unquantifiable due to the vagueness of the requirements, and we believe it will be considerably expensive. A demonstration of how expensive this bill will be that the public sector, Medi-Cal, is being excluded from the bill to avoid cost and appropriations, thus leaving the cost solely on private purchasers of health care coverage. For these reasons, we cannot support the expansion of autism services at this time, and we are opposed to SB 1034.
Thank you. Please.
Good afternoon. Sherry McHugh, representing the California Chamber of Commerce. We are opposed to the bill due to the additional costs that it will add to the system and that will unfortunately ultimately result in higher premiums for businesses and individuals trying to comply with the ACA. Thank you.
Thank you very much. Others in opposition, just your name and organization, please.
Yeah, John Winger on behalf of America's Health Insurance Plans would echo the comments of Cap.
Thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies also opposed.
Thank you. Anyone else? Seeing no one, bring it back to the committee for questions, comments. Do you have
Thank you, Mr. Chair. Thank you. I have several questions. I've really been struggling with this bill back and forth, and I remember when the first one passed, and I was concerned with that one at the time and ultimately laid off the bill because I was concerned about leaving Medi-Cal plans out and PERS plans. So I'll start with that. If you could speak to that a little bit. I assume it's the cost issue and the problems with appropriations, but it is disconcerting that people on Medi-Cal or on PERS programs wouldn't have access to these programs.
So people on PERS do have access to these programs. They are not exempt. It was later determined that the provisions of 946 did apply to those CalPERS plans under mental health parity. As it turned out, this was an existing benefit all along under mental health parity, but 946 laid out the provider structure to make sure that people could actually get reimbursed and it was accessible. Earlier this year, behavioral health treatment began being covered in the Medi-Cal program. There was some budget trailer bill language, I believe, last year, and that is now covered. However, that's covered under the state plan amendment. We don't want the state to have to go back and renegotiate the provisions of the state plan amendment. So for that reason, Medi-Cal is not in this bill, but please be assured there is coverage on the Medicaid side through the SPA.
Okay, thank you. That's very helpful. And then I'm sorry, did you want to add?
I was just going to, it's not necessary. Go ahead with your next question.
And then does the bill require, I feel like we've gone back and forth on this maybe, does it require the programs to be ABA evidence-based, or could it be any program within the autism community?
We're not changing what's currently covered in the benefit. The existing law says behavioral health treatments is defined as applied behavior analysis and other evidence-based behavioral treatments. We're not changing that. We are keeping that existing law. Okay. So if a plan determines that something else is evidence-based, that could certainly be included. We didn't want to close the door on that. That's why we included the other evidence-based.
Okay. Okay. And then my other question, perhaps to Jennifer, although feel free to comment as well if you guys have thoughts on this. One of the, I would say, historic problems across the nation is the insufficient funding for special education programs at the federal level. All of our schools are woefully short of federal funds for special education. And today, Senator Schumer wrote a letter to the Senate Appropriations Committee in Congress about the need to fully fund IDEA, the Individuals with Disabilities Act program. So one of my questions is, how does the health insurance world fit into that federal funding program under IDEA? And then the second question would be, if we now fund these programs through health insurance plans, does that then take the pressure off of the feds to properly and sufficiently fund special needs programs, IEPs, IDEA, et cetera?
Currently, health plans are not required to go into school settings to provide any health treatments, for example, physical therapy, occupational therapy, speech therapy, and whatnot. That's part of the free and appropriate federal education. My members report to me that they will go into a school setting to provide observational care to see what behavior is going on with the child, but that the treatment for that would take place outside of school. we're looking at 48 different health plans and 1,000 different school districts that have the ability to determine who can and can't come on their campus. And so part of our concerns with pushing us into there is what happens to the health plan if we're required to provide something and the school says no. What is our liability for that coverage?
Okay, thank you. And Senator Mitchell, can you speak to, or your sponsor, how maybe that interplay would work between the school districts and the health plans?
Well, what strikes me, I think, about the opposition's argument, and it's not the first time I've heard it, while they say they're sympathetic, it does strike me that their fundamental understanding of what behavioral health services are, and this whole notion that it can be confusing or not work collaboratively well with special education services troubles me, because they're very different. Services allowed through an IEP are campus support services. Behavioral health are very different, and so I don't see that there's any conflict at all. And school districts aren't required to provide traditional behavioral health services, hence the need for the role of the plans. This whole notion that they aren't going to be provided in clinical settings is because they're not clinical services. They're behavioral health services. So there's a really fundamental kind of difference here. And again, my concern, based on their opposition, suggests that there really isn't an understanding of what those health services are, because they aren't clinical and they do not conflict with what school districts do. IEP, special education, it's academic based in terms of appropriate supports to be successful in the classroom. The behavioral health services are much broader in terms of overall behavioral health support. I don't know if that answers you. And I don't know in terms of at the federal level, but if it's focusing on special education dollars and supports for the classroom, I don't think they overlap at all.
Okay. Thank you.
Anything you want to add to that?
Yeah, if I could just add to that. In terms of special education, that's talking about something that's part of an education plan to meet their educational needs that's being provided by school personnel. We are very specifically talking about treatment that's part of a health treatment plan that is designed by a qualified autism service provider and delivered by a qualified autism service provider. This is something that is a health benefit. It's completely separate.
And so you're just expanding the times at which those services could be provided?
We actually don't view it as expanding the times and services that it can be provided. We're simply stating that you can't use that as a reason to deny treatment, medically necessary treatment.
Okay. Thank you.
Other questions from the committee? Anyone else? Mr. Nazarian?
I just wanted to say, if we had a quorum, I would have moved the bill.
I appreciate
so
that.
So thank you for your work on
Thank
this.
you.
I look forward to supporting your bill.
Thank you very much. Appreciate that.
Anyone else? Senator, would you like to close?
Thank you very much. I appreciate the questions. Allowed us to provide some clarity around the Medi-Cal and PERS issue. That was important for all of us here. The last piece I would raise is the notion around parental support. And what we were concerned about, and it's not to suggest that parents on the natural wouldn't be engaged fully in the behavioral health support plan for their child. What we had found is that services were being denied because a parent couldn't make a particular day, a particular time of day. And so the language in the bill simply says they're not required, so the service won't be denied because mom's not available at 2 in the afternoon, where she may be either at work or supporting another child in the family at school. So I wanted to make that very clear, because you heard from some very passionate parents, and it's not about taking a walk in terms of active participation. Again, the sunset was put in place before. We're continuing the sunset. I've heard from ARCA. I get their perspective, because we want to continue to benefit from the experience we have in providing this program. When we come back in 5 years, to very likely once again ask that the sunset be lifted. Hopefully, again, we will be able to add policy to the table based on our experience over the next 5 years. With that, we ask that you continue to support the needs of children with autism, and I ask for your aye vote.
Well, thank you, Senator, for the presentation and your hard work on this issue. When we get a quorum, we'll ask for a motion and bring it for a vote. So thank you very much.
Thank you.
So, we have one more.
Unfortunately for you, you have.
No, it's not unfortunate at all. We're happy to have you.
One more. SB 1090, colleagues, a bill that requires the Department of Public Health to allocate funds to counties for sexually transmitted disease outreach and screening services. Tragically, STDs remain a large and persistent public health challenge for the residents of our state. Data from the California Department of Public Health tells us that the incident rates of sexually transmitted disease increased dramatically from 2010 to 2014. Chlamydia has risen by 12%, gonorrhea by nearly 70%. Primary and secondary syphilis have smaller raw numbers but have grown at a rate of 84%. SB 1090 seeks to correct various inadequacies by providing specific direction to the Department of Public Health in several ways. Number one, to prioritize funding for counties that have higher incidence rates of STDs. To direct counties to establish effective outreach protocols. To urge counties to develop relationships with CBOs for outreach and screening services. CBOs, as we have found across the state, often can do more with less and can leverage other resources. Lastly, it's to encourage innovative outreach and screening services. With me here today is one of the co-authors, co-sponsors of the bill, AIDS Healthcare Foundation. Representing them today is Rand Martin.
Mr. Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation. You all know AHF is the leading provider across the globe in terms of care and treatment for people with HIV, but we're also a major player in the STD world since STDs are often a precursor to HIV. The Senator has accurately conveyed our concerns about the statistics in this ongoing problem. But it's astonishing to us that with all the treatments available to control STDs, that we're seeing a rise and not a reduction in STDs. And that's because the state has not done enough, either statutorily or financially, to get under control. We're also beginning to see from a federal and global standpoint that not only are we seeing a rise in STD numbers, but we're seeing a rise in strains of STDs that are not responding to traditional forms of treatment. And that is a very scary proposition as we see the rise as well as the rise in those that can't be treated. We do know that, or are aware that one of the concerns I think you, Mr. Chair, has raised in response to DPH's letter that you saw recently was whether this was intended to replace what DPH is doing currently. It is not our intent to be a replacement in this vehicle for what they're doing now. It is certainly our intent to augment what they're doing. We think they are doing some good things with very little money. We think they need to do more things. Fortunately, the legislature, signed yesterday by the governor, included an additional $5 million. That was more than double what they had in their budget as of last year. We think that's a good sign. We think coupled with this bill, we can make some real progress. And we're happy to clarify, Mr. Chair, if you need clarification, that this is intended as an augmentation and not a replacement. Thank you.
Great. Thank you.
Mr. Chair and members, Tim Madden, representing the California chapter of the American College of Emergency Physicians, and we strongly support the idea of outreach to folks to expand screening services, and we would like the idea of the innovative approaches mentioned in the bill in terms of using social media to try and reach out to folks who don't normally get touched in terms of getting communicated to about the importance of screening services. For these reasons, we urge your support.
Great. Thank you very much. Others in support? Name and organization, please.
Randy Hicks, volunteer of Planned Parenthood, in strong support.
Great. Thank you. Anyone in opposition? Seeing no one, we'll bring it back to the committee. Questions or comments from the committee? Seeing none. Senator Mitchell, would you like to close?
Very briefly, Mr. Chair, I would just say to imagine that in 2016 that we're seeing increases in gonorrhea transmission rates in places like Butte County at 395%, Santa Cruz County 261%, Orange County 52%. Clearly, we have fallen asleep at the wheel, and thank goodness with the augmentation reflected in the state's budget. Hopefully, with the passage of SB 1090, we'll be able to reverse some of those trends, and I ask for your aye vote.
Thank you, Senator Mitchell. And once again, many thanks for working on a very difficult topic. This bill does enjoy a support recommendation, so when we have a quorum, as does your previous bill, we'll bring it up for a vote. So
thank you, sir. Thank you
very
members.
much. With that, Senator Hernandez,